Imagine that you are sitting in the doctor's office, waiting for your blood pressure to rise, and you feel how your heart is starting to accelerate. The brothers give you a little Sudan and don't find it difficult to breathe faster than normal. The nurse places the bracelet on your arm, and when you look at the numbers on the screen, you feel that the floor opens beneath your feet. I know 40 over 90. I know 50 about 90 and 5. The numbers keep rising, and you wonder what's going on if just an hour ago you felt perfectly good. What you don't know is that in this precise moment, your way of breathing has just become your worst enemy and is causing your blood pressure to shoot up like a bullet within minutes. This is one of the best-kept secrets that cardiologists know, but that we rarely explain to our patients in a way that they can really understand and apply in their daily lives. Today I'm going to reveal to you exactly what respiratory error is raising your blood pressure without letting you know. And most importantly, I'm going to teach you 3 specific breathing techniques that can reduce your blood pressure naturally in less than 2 minutes. I'm not talking about abstract theories or vague advice. I am talking about scientifically proven techniques that I have seen work on thousands of patients during my years of practice as a cardiologist. Techniques are so powerful that some of my patients have managed to reduce or even eliminate their blood pressure medications under medical supervision by default. So if you suffer from hypertension, or if you simply want to protect your heart and arteries from the silent damage that causes high blood pressure, stay with me until the end of this video, because what you are going to discover could literally save your life. Before continuing, I invite you to subscribe to this channel and activate the notifications bell. Here we share valuable information about cardiovascular health, natural remedies, and techniques backed by science that can transform your life without the need for costly or complicated treatments. Each week we publish new content designed specifically for people like you who are looking for natural and effective solutions to control their blood pressure and improve their heart health. By subscribing, you join a community of thousands of people who have decided to take control of their health naturally and are seeing real results in their blood pressure, their energy, and their quality of life. Don't miss any videos, because each one contains information that your doctor probably doesn't have time to explain in a 5-minute consultation. Subscribe now, and let's start this journey together with a healthy blood pressure and a strong heart. Now let me explain to you exactly what is happening in your body when you make this common respiratory error. The majority of people, especially those who suffer from stress or high blood pressure, have a completely wrong respiratory pattern without knowing it. They breathe quickly, superficially, and mainly with their chest instead of slowly deep breathing with their abdomen. This type of breathing that doctors call chest breathing or superficial breathing is one of the biggest silent saboteurs of your blood pressure. When you breathe like this, your body interprets this signal as a dangerous or stressful situation. Your sympathetic nervous system, which is responsible for the fight response, activates immediately. This triggers a cascade of reactions in your body that include the release of stress hormones such as cortisol and adrenaline. These hormones make your blood vessels constrict. Your heart grows faster and stronger, and your blood pressure rises dramatically within minutes. It's like your body is preparing to face a tiger when in reality you're just sitting at home watching television or working on your computer. The problem is that this respiratory pattern becomes a habit so ingrained that it happens automatically throughout the day without a second thought. And every time you breathe this way, you are sending alarm signals to your body that keep your blood pressure chronically high. Scientific studies have demonstrated something absolutely fascinating about the connection between breathing and arterial pressure. Researchers at Harvard University discovered that people who practice slow and deep breathing for just 10 minutes a day can reduce their systolic blood pressure in a mean of 2 points and diastolic pressure in 5 points. These numbers are equivalent or even higher than those obtained with some medications for hypertension, but without any secondary effects. Another study published in the Journal of Hypertension found that controlled breathing can reduce blood pressure as effectively as some changes in the lifestyle that doctors traditionally recommend, such as weight loss or salt reduction. But here's the really exciting part. These benefits won't take months to appear. You can start seeing results in your blood pressure readings within days or even hours after starting to practice correct breathing techniques. The reason this works so quickly is because breathing is the only automatic process in your body that you can also control consciously. It's like a direct switch that allows you to influence your autonomous nervous system and decide for your body to relax, lower the guard, and reduce blood pressure. Now I'm going to reveal 3 specific breathing techniques that I recommend to my patients with hypertension. These techniques are simple to learn but incredibly powerful in their effects. The first technique is called diaphragmatic breathing or abdominal breathing and is the fundamental basis for everything else. To practice this technique, keep your head in a comfortable position. Place one hand on your chest and the other on your abdomen just below your ribs. Now you will inhale slowly through your nose for 4 seconds, concentrating on bringing the air to the lower part of your lungs so that your abdomen expands like a globe. The hand that is on your chest must move up to the top, while the hand on your chest must remain relatively still. This is crucial because it means that you are breathing with your diaphragm, which is the most important and efficient respiratory muscle you have. After inhaling, hold the air for 2 seconds and then exhale slowly through your mouth for 6 seconds. Feeling how your abdomen gradually deflates, exhalation must be longer than inhalation because this is the moment in which your parasympathetic nervous system, responsible for relaxation, activates with greater force. Repeat this cycle for 5 to 10 minutes every 3 times, especially at times when you feel stressed or notice that your blood pressure is high. The second technique that I want to teach is called 4-7-8 breathing and was popularized by Dr. Andrew Weil, a renowned doctor from Harvard University. This technique is incredibly effective for reducing blood pressure quickly because it deeply activates your parasympathetic nervous system and produces an instantaneous state of calm. To practice it, place the tip of your tongue against the palate just behind your upper forehead and keep it there throughout the exercise. Exhales completely through the mouth, making a hissing sound. Open your mouth and inhale silently through your nose for 4 counts. Maintain breathing for several hours. Luego exhales completely through his mouth, making the sound of hissing for as long as he can remember. A cycle is complete. Repeat this cycle 3 or 4 more times for a total of 4 breaths. The most important thing about this technique is not the exact amount of time you dedicate to each phase without the proportion between them. Inhalation should be relatively short, air retention should be approximately twice as long as inhalation, and exhalation should be twice as long as retention. This specific proportion creates physiological changes in your body that force your blood pressure to decrease. The reason why it works so well has to do with the accumulation of carbon dioxide during the retention phase and the activation of the vagus nerve during prolonged exhalation. The vagus nerve is like the orchestra director of your relaxation system, and when you correctly stimulate it, your blood pressure drops, your heart rate decreases, and your entire body enters a state of deep calm. Practice this technique sometimes, every day when you wake up, and before going to sleep, and also use it anytime you feel stressed, or anxious or notice symptoms of high blood pressure, such as headaches, blurred vision, or palpitations. The third technique I'm going to share with you is called cardiac coherence breathing and is one of my favorites because it is supported by decades of scientific research in cardiology. This technique was originally developed by scientists at the HeartMath Institute in California and has been adopted by hospitals and clinics around the world for the treatment of hypertension and cardiovascular diseases. The objective of this technique is to synchronize your breathing with your heart rate, creating a state of coherence where all your body systems work in perfect harmony. To practice it, sit comfortably with a straight back and feet supported on the floor. Close your eyes if you feel comfortable holding it and bring your attention to the area of your heart in the center of your chest. Imagine that you are breathing directly through your heart, as if air enters and exits through the center of your chest. Inhale slowly for 5 seconds and exhale slowly for 5 seconds. The key here is to maintain a constant and smooth rhythm of 6 breaths per minute, which is the optimal rate for creating cardiac coherence. As you breathe, you try to evoke a positive feeling like gratitude, love, or appreciation. Think about something or someone that makes you feel good in your heart. This emotional component is not just something pleasant, but is absolutely essential. To maximize the cardiovascular benefits of this technique, studies have demonstrated that when you combine rhythmic breathing with positive emotions, it produces a specific pattern in the variability of your heart rate that dramatically reduces blood pressure, improves the function of the immune system, and reduces cortisol levels in your blood. Practice this technique for 5 minutes 3 times a day. You can do it in the morning, for half a day, and in the evening before you set off. Many patients have reported significant reductions in their blood pressure after weeks of constant practice of this technique. Now I want to take a break and ask you something important. If at this point you have found value in this video, if you are learning something that could improve your health, I want you to leave a comment below and let me know what your biggest challenge is with blood pressure. Write exactly this and complete the sentence: my greatest challenge with arterial pressure is that I can't complete it with your specific situation. It may be that you cannot control it with a diet that cannot reduce medications, that cannot eliminate stress, or any other challenge you face. Your comments on the ground help me create better and more relevant content for you, but also help other people who are going through similar situations to feel understood and supported. Many times the simple effort to express what is costing us work is the first step to finding the solution. Furthermore, when you comment, you are helping this video reach more people who really need this information. YouTube awards videos with the highest interaction by showing them to more people who could benefit from these techniques that can literally save lives. So it only lasts for a few seconds now, and I leave your comment. I will be reading each of them personally and answering your questions. Your participation really makes a difference, as you don't have to share your experience with the community. Now that you know these 3 fundamental techniques, let me explain exactly when and how you should use them to obtain maximum benefits in your blood pressure. It is ideal for you to incorporate these practices into your daily routine in a strategic way at times when your blood pressure tends to be higher. For the majority of people, blood pressure reaches its highest peak in the first few hours of the morning, between 6 and 10 approximately. This phenomenon is known as the morning increase in blood pressure and is one of the reasons why many cardiovascular events such as heart attacks and strokes occur with greater frequency during these hours. Therefore, I recommend that you practice diaphragmatic breathing for 5 to 10 minutes immediately after waking up before even getting out of bed. This will help to counter this natural increase in blood pressure and start the day with your cardiovascular system in a calmer and more balanced state. I do it a lot of the day when work stress or everyday worries could be affecting your blood pressure. Practice the cardiac coherence technique for 5 minutes. You can do it in your office, in your car, during your lunch break, or in any place where you can take a few minutes of tranquility. This midday practice will act as a reset of your nervous system, lowering the levels of cortisol and adrenaline that have accumulated during the morning. Finally, before bed, use the 4-6-8 technique to help your body enter a deep state of relaxation. Being on the ground will help reduce your nighttime blood pressure, which will also significantly improve your sweat quality. And here is something that many people don't know, and the problem of poor quality is one of the factors that most contribute to chronic hypertension. When your body produces more stress hormones, your blood vessels do not relax properly during the night, and your blood pressure remains high even during sleep. By improving your sweat with breathing techniques, you are attacking hypertension from multiple angles at the same time. In addition to these programmed practices, you should also use breathing techniques as an emergency tool in specific situations that you know will raise your blood pressure. For example, before a medical appointment, it makes you nervous because it is exactly in these moments when many people experience the phenomenon of white coat hypertension, where blood pressure shoots up simply by being in a doctor's office. If you breathe 4 times a day for 5 minutes before you go under pressure, you can avoid these falsely elevated readings and obtain a more accurate measurement of your real blood pressure. The same applies before stressful situations as an important presentation, a difficult conversation, or any event that causes you anxiety. Instead of allowing these situations to arise, your blood pressure can actively prevent it by using your breathing as natural medicine. Other crucial moments to practice these techniques are when you feel the first symptoms of high blood pressure, such as headaches, tension in the brain, blurred vision, or the sensation of pressure in the chest. In these cases, the 4-6 technique can often act as a rescue medicine, reducing your blood pressure in a matter of minutes and alleviating these uncomfortable and potentially dangerous symptoms. It is important that you also understand the complete scientific mechanism of why these techniques work so well to lower blood pressure. When you breathe slowly and deeply, especially when the exhalation is longer than the inhalation, you are directly activating your parasympathetic nervous system through stimulation of the vagus nerve. The vagus nerve is the longest nerve in the body and connects your brain with practically all your main organs, including the heart, lungs, stomach, and intestines. When this nerve is activated, it sends signals to your heart so that it can grow more slowly and with less strength, to your blood vessels so that they relax and dilate, and your adrenal glands so that they stop producing stress hormones. All of this results in a direct and immediate reduction in your blood pressure. But there is more. Slow and deep breathing also improves the oxygenation of your tissues, which helps your cells function more efficiently and produces fewer free radicals that are harmful molecules that can damage the lining of your arteries and contribute to chronic hypertension. Furthermore, when you breathe correctly, you are improving endothelial function, which is the capacity of your arteries to dilate and contract appropriately. The endothelium is the inner layer of your blood vessels, and when it is healthy, it produces a substance called nitric oxide, which acts as a powerful natural vasodilator. Many medications for high blood pressure work precisely by trying to increase nitric oxide levels in the body, but you can achieve the same effect naturally, simply by breathing correctly. Another fascinating aspect of these techniques is their effect on arterial stiffness. With age, and especially when there is chronic hypertension, the arteries become more rigid and less flexible. This arterial stiffness means that the heart has to work harder to pump blood through the circulatory system, which increases arterial pressure even more, creating a dangerous vicious circle. Studies have demonstrated that regular practice of breathing techniques can literally reverse arterial stiffness, allowing your blood vessels to regain their youthful elasticity. A particularly impressive study published in the American Journal of Hypertension found that participants who practiced slow breathing for 8 weeks reduced the stiffness of their arteries by 20%. This is equivalent to rejuvenating your arteries in approximately 5 to 10 years. Imagine being able to turn back the clock of your cardiovascular system simply by dedicating a few minutes a day to breathing correctly. It is one of the most powerful and at the same time most accessible interventions that exist for the health of the heart and arteries. I also want to talk about some common mistakes that people make when trying to practice these techniques, and that can completely sabotage their results. The first error is breathing too deeply or too forcefully. Some people think that the better result will be between more inhaled airs, but this is completely false. Breathing should be smooth, comfortable, and natural, not forced. If you breathe too deeply or too quickly, you can hyperventilate, which can paradoxically make you feel anxious and can even temporarily raise your blood pressure. Correct breathing is like a gentle and constant wave, not like a hurricane. The second common mistake is practicing the solo irregularly when you feel bad. For these techniques to produce lasting changes in your blood pressure, you need to practice them consistently every day, even when you feel good. Think about it like picking up your loved ones. Don't wait until you get cavities to get rid of it, unless you do it preventively every day. This same thing should be applied to your breathing practice. The third error is not paying attention to your posture. Your posture has a huge impact on your ability to breathe correctly. If you are hunched over or with a hunched chest, your diaphragm cannot move freely and your breathing will be shallow no matter how hard you are. Make sure you always sit upright with a straight back, but don't keep your shoulders relaxed and your chest slightly open. This posture allows your diaphragm to move through its full range of movement and maximizes the benefits of each breath. The fourth error that I see frequently is not being patient with the results. Although some people experience immediate reductions in their blood pressure from the first practice session, others may take several days or weeks to see significant changes in their readings. This does not mean that the technique is not working, but you need time to unlearn the incorrect respiratory pads that you have been using for years or decades and replace them with new and healthier ones. Don't be discouraged if you don't see spectacular results right away. Trust in the process to maintain constant practice and achieve results. Many of my patients have told me that after 2 or 3 weeks of daily practice, they suddenly noticed that their blood pressure had dropped significantly and sustainably. The fifth mistake is not combining breathing techniques with other healthy lifestyle changes. Even though breathing is incredibly powerful, it is not a magic solution that can completely compensate for a terrible diet, lack of exercise, or extreme levels of chronic stress. To obtain the best results, you must see breathing as a fundamental part of a comprehensive approach to controlling your blood pressure. This also means eating more foods rich in potassium and magnesium, reducing salt intake by exercising regularly, even if you walk for 3 minutes a day, maintaining a healthy weight and finding ways to manage stress in addition to breathing, such as meditation and yoga or the activities you enjoy. Let us now consider something very important: the relationship between breathing, emotional stress, and arterial pressure. Chronic stress is one of the most powerful factors that maintain persistently high blood pressure. When you live in a constant state of worry, anxiety, or emotional tension, your body is literally bathed in stress hormones for every hour of the day. These hormones keep your blood vessels constricted, your heart racing, and your blood pressure chronically high. It's fascinating that your breath is the direct bridge between your mind and your body. When you consciously change your way of breathing on the ground, you are affecting your physiology as well as your emotional state. It is practically impossible to feel anxious or stressed while breathing slowly, deeply, and controlled. Your brain receives contradictory signals. On one hand, the external situation can be stressful, but on the other hand, your respiratory system is telling your brain that everything is fine and there is no danger. And the brain tends to trust the internal signals of your body more than the external circumstances. This means that you can use your breathing as a tool to reprogram your response to stress and literally train your body so that you stop overreacting to situations that are not true threats to life or death. Over time, this reprogramming becomes automatic and your resting blood pressure begins to normalize permanently. Allow me to share with you some real cases of my patients who have transformed their blood pressure using these techniques. There was a patient we called Roberto, who came to my office with a blood pressure of 65. He was taking different medications for hypertension, but his pressure continued without being properly controlled. Roberto was a businessman of 45 years who lived under constant stress and admitted that he had never paid attention to the way he breathed. He taught me the 3 techniques I shared with you today and asked him to practice them religiously for 3 days. I also suggested some changes to your diet, but the main focus was breathing. After just a few weeks, Roberto returned to follow-up and his blood pressure was already low for 49 years. After 2 months, his arrest was still under 25 years, completely normal and under supervision. We were able to reduce one of his medications to a limited extent. 6 months later, Roberto only needed a low-dose medication and his blood pressure remained consistently at healthy levels. He tells me that the practice of breathing on the ground improved his blood pressure and also transformed his ability to manage the stress of his sweat quality and his general sense of well-being. Another memorable case was that of Maria, a 50-year-old woman with white coat hypertension. His blood pressure was normal at home, but he skyrocketed for over 70 years each time he visited the doctor's office. He teaches for 7 Nacho techniques specifically to use before each blood pressure measurement. The difference was dramatic. Next visit after practicing the technique for 5 minutes before he took the pressure on the reading for 25/75. Maria was finally able to get accurate readings of her blood pressure in the office and avoided being unnecessarily medicated. Now I want to give you some additional practical tips to maximize the benefits of these techniques in your daily life. First, consider using a guided breathing app on your phone. There are many excellent free applications that can help you maintain the correct rhythm, especially while you are learning techniques. Some popular apps include visual indicators that expand and contract at the correct pace so you can simply follow the movement with your breathing. This can be especially useful for the cardiac coherence technique where maintaining exactly 6 breaths per minute is crucial. Secondly, create reminders on your phone or place sticky notes in strategic places in your home or office that remind you to practice your breathing. Consistency is absolutely key, and these visual reminders can help you establish the habit until it becomes automatic. Thirdly, consider combining your breathing practice with other habits that you have established. For example, you can practice diaphragmatic breathing while taking showers throughout the morning or cardiac coherence while waiting for your coffee to heat up. This technique of improving habits makes it much easier to maintain the practice over a long period of time. Fourth, keep a record of your blood pressure and breathing practices. Write down when you practice each technique and measure your blood pressure regularly at the same time of day. In time, you will be able to see clear indications of how your breathing practice is affecting your numbers. This tangible evidence of your progress can be incredibly motivating and will help you maintain your commitment to practice even on days when you don't feel especially motivated. It is also important that you talk to your doctor about these techniques, especially if you are taking medication for high blood pressure. I'm not suggesting that you give up your medications at your own expense. What I'm saying is that these breathing techniques can be a powerful complement to your current medical treatment and in many cases can allow your doctor to gradually reduce your medication dosage or even eliminate some of them if your blood pressure is controlled properly. However, this must always be carried out under medical supervision with regular monitoring of your blood pressure and gradual adjustments of medication if appropriate. Never change your medication for your own sake without consulting your doctor first. What you can do immediately without needing to consult your natty is to start practicing these breathing techniques. There are no secondary effects on the money and only require a few minutes of your time every day. In the worst case, you will feel more relaxed and peaceful. In the best of cases, you can experience significant reductions in your blood pressure that will improve your cardiovascular health and your quality of life in ways that you probably couldn't even imagine right now. I want to emphasize something else that is absolutely crucial. Breathing on the ground affects your blood pressure at the moment it is practiced, which has long-term cumulative effects that could be even more important. Every time you practice slow and controlled breathing, you are literally retraining your autonomic nervous system. You are teaching your body to have a higher vagal tone, which means that your vagal nerve is more active and your parasympathetic relaxation system is stronger. With this translates into lower resting blood pressure and healthier heart rate variability, which is a key marker of cardiovascular health and a more balanced stress response. Your body becomes less reactive to everyday stressors and more resilient in the face of difficult situations. This is like training a muscle. The more powerful practices become, and eventually your nervous system operates in a more relaxed way, in a predetermined way, without you having to think about it consciously. Another important dimension of these techniques that I cannot fail to mention is their impact on chronic inflammation. Inflammation is one of the most important underlying factors in hypertension and cardiovascular diseases in general. When your body is in a state of low-grade chronic inflammation, your arteries become less flexible and plaques accumulate more easily, and your risk of cardiovascular events increases dramatically. What is fascinating is that scientific research has demonstrated that controlled breathing techniques can reduce markers of inflammation in your blood, such as C-reactive protein and pro-inflammatory cytokines. A study carried out in the Low Countries found that people who practiced specific breathing techniques showed a reduction of 50% in the inflammatory response of their immune system. This means that by practicing these techniques on the ground, you are directly lowering your blood pressure. But you are also attacking one of the root causes of hypertension and protecting your cardiovascular system at a much deeper level. You are literally putting out the fires of inflammation that are damaging your arteries from within. Now I want to share with you a specific 7-day protocol that you can start today to start seeing real results in your blood pressure. This protocol is designed to be simple and easy to follow, but also effective enough to produce measurable changes in your numbers. One day we start establishing your baseline. Measure your blood pressure throughout the morning after waking up, but before practicing any breathing technique. Write down the number. Luego practices diaphragmatic breathing for 10 minutes. After finishing, wait 5 minutes and go back to measuring your blood pressure. Also write down this number. This comparison will show you the immediate effect of the technique on your body and will give you motivation to continue. During the rest of the day, practice diaphragmatic breathing for 5 minutes every 3 to 4 hours. Set alarms on your phone if necessary to remind you. Maintain the practice of diaphragmatic breathing every day, but add the technique for weeks before bed. Practice for complete cycles of the technique for 4 weeks just before setting off. Write down in a diary how you feel and how you spend that night. Day 3 continues with the same practices from 1 and 2 days, but adds a session of cardiac coherence every half of the day. Practice for 5 minutes while visualizing something that makes you feel grateful or love. For days, increase the duration of your morning diaphragmatic breathing practice to 15 minutes. Keep other practices the same. Go back to measuring your blood pressure for the morning before and after your breathing practice. Compare these numbers with those from the first day. The majority of people are starting to see a small reduction at this point. Day 5 adds a second cardiac coherence session at the end of the afternoon. Now you are practicing cardiac coherence sometimes every day for diaphragmatic breathing for the morning and technique for weeks before bed. Day 6 is a day of intensive practice. Increase all your sessions by 5 minutes each. This day you are dedicating approximately 40 minutes in total to breathing practice distributed throughout the day. 7 days later, measure your blood pressure for the morning before your breathing practice. Compare this number with your baseline for the first day. Most people experience a reduction of at least 5 to 10 points in their systolic pressure after a week of constant practice. If you don't see results, don't be discouraged. Some people need 3 weeks to see significant changes. It is important to maintain constant practice. After completing this 7-day protocol, establish a maintenance routine that can be sustained over the long term. Your ideal daily routine should include at least 5 to 20 minutes of breathing practice spread across 2 or 3 sessions throughout the day. A session in the morning to start the day calmly, a session every half day to reset your nervous system, and a session in the evening to promote a restorative sleep. This time investment is minimal compared to the benefits you receive on the ground in your blood pressure, your general health, your state of mind, your energy, and your ability to manage stress. Do it this way. If you have to take a tablet 3 times a day to control your blood pressure, you will never question the truth. These breathing techniques are like a natural medicine that you are taking 3 times a day, but without cost-effective side effects and with benefits that are much greater than simply lowering a few numbers on a blood pressure monitor. I also want to address some common questions that my patients ask me about these techniques. The first question is whether these techniques can completely replace blood pressure medications. The honest answer depends on each individual case. For some people with mild or moderate hypertension, especially if it is mainly related to stress and lifestyle, these techniques together with other healthy changes can be sufficient to control blood pressure without medication. However, for people with severe hypertension or with certain underlying medical conditions, medications continue to be necessary, and these techniques can be seen as a valuable complement that can allow you to use lower doses of medication or reduce the number of medications needed. The decision to adjust or discontinue medications should always be made in consultation with your doctor and based on regular monitoring of your blood pressure. The second common question is how long it takes to see permanent results. Although you can experience immediate reductions in your blood pressure during and after each practice session, permanent changes in your resting blood pressure generally require 4 to 8 weeks of constant practice. This is because your body needs time to reverse years or decades of dysfunctional patterns and establish new, healthier patterns in terms of the nervous system and the cardiovascular system. Patience and constancy are absolutely crucial. The third question is that I often receive some contraindications or situations where these techniques are not safe. In general, these techniques are extremely safe for most people. However, there are some precautions that you should take into account. If you have chronic obstructive pulmonary disease, severe asthma, or any other serious respiratory condition, you should consult your doctor before starting these practices. In some cases, it may be necessary to modify the techniques to adapt them to your respiratory capacity. Also, if you have very low blood pressure, you should be careful because these techniques can lower your blood pressure even more. In this case, it would be better to focus on more energizing breathing techniques rather than the relaxing techniques that I have shared here. If you experience nausea or any other uncomfortable symptom during practice, stop immediately and breathe normally. This generally means that you are breathing too deep or too fast and need to make the practice softer and more gradual. Correct breathing should always feel comfortable and relaxing, never forced or uncomfortable. The fourth common question is whether these techniques work for all types of hypertension. The answer is that it works better for certain types of hypertension than for others. They are especially effective for hypertension related to stress, white coat hypertension, early or mild hypertension, and treatment-resistant hypertension where medications are not working properly. They are also very useful for people who experience large fluctuations in their blood pressure throughout the day. However, if your hypertension is mainly caused by kidney problems, hormonal imbalances, or specific genetic conditions, breathing techniques can help but will probably not be sufficient on their own, and you will need more specific medical treatment for your underlying condition. In any case, even though breathing techniques will not completely cure your hypertension in these cases, they will continue to provide you with additional benefits in terms of managing stress, quality of life, and general cardiovascular protection. Now, I want to talk about an aspect that most often mentions but that is absolutely fundamental for long-term success with these techniques. It's about breathing during the day when you're not actively practicing. Many people practice their breathing techniques for 10 to 20 minutes every day. But for the next 25 hours, they continue to breathe in a shallow and dysfunctional way. It's like trying to fill a bucket with water while there's a huge water fountain at the bottom. You will never get where you want to go. The key is to start developing awareness of your breathing throughout the day and correcting your respiratory pattern even when you are not in a formal practice session. Here is a simple technique that you can use several times a day. Perhaps every time you call, you sweat, or every time you pass a door, there is a 5-second pause and observe how you are breathing. Preguntate, I'm breathing with my chest or abdomen. I'm breathing fast or slow. My breathing is tense or relaxed. Simply with this act of unjudged observation, you will automatically begin to breathe in a healthier way. Your brain will naturally correct dysfunctional patterns once you are aware of them. In time, you will develop what is called respiratory awareness, where a part of your attention is always monitoring and optimizing your background breathing. When you reach this point, you will truly transform your relationship with your breathing, and the benefits of your blood pressure and your general health will be exponential. I also want to share with you some specific signs that the techniques are working more than the blood pressure numbers. Many times the benefits manifest themselves in subtle forms before you see dramatic changes in your blood pressure readings. Pay attention to these indicators. First, best quality of sweat. If you start sleeping more deeply and find yourself sleeping more quickly or waking up feeling more rested, this is a clear sign that your nervous system is rebalanced. Second, reduction in headaches. Many people with hypertension suffer from frequent headaches, especially in the back of the head and the skin. If these headaches diminish or disappear, it is an indicator that your blood pressure is beginning to normalize. Thirdly, less palpitations or the sensation of a racing heart. If you notice that your heart barks more calmly and constantly throughout the day, this indicates that your sympathetic nervous system is less hyperactive. Fourth, greatest sensation of calm and emotional control. If you find yourself reacting less intensely to stressful situations or recovering more quickly after difficult moments, your nervous system is becoming more resilient. Fifth, less muscle tension, especially in the shoulders, hips and jaw. These areas tend to accumulate tension when we live in constant stress mode, and their relaxation indicates that your body is entering a more balanced state. Sixth, best digestion. When your parasympathetic nervous system is more active, your digestion improves because this system controls digestive functions. If you notice less swelling, less tightness, or better regulated appetite, this is another positive sign that the techniques are working. It also allows me to give you some tips to maintain motivation over the long term, because this is one of the biggest challenges people face with any health practice. It's easy to be motivated during the first week or two, but maintaining the practice for months and years requires specific strategies. First, link your breathing practice with an immediate and tangible benefit that is very valuable. For some people, this is the ability to sleep better. For others, it means feeling calmer in stressful situations. For others, it's the satisfaction of seeing your blood pressure numbers drop. Identify which benefit is most significant to you personally and remember that benefit every time you practice. Secondly, find a practice partner. You could be a friend or family member who also wants to improve your health. Commit to practicing together or reporting to each other on your daily practice. Social support makes a huge difference in long-term adherence. Tercero, celebrates your little achievements. Every week that you maintain your constant practice is an achievement that deserves recognition. Every point that lowers your blood pressure is a victory. Don't expect perfection or instant miraculous results. Appreciate gradual and constant progress. Fourth, be flexible and compassionate with yourself. There will be days when you cannot practice or when your practice is less focused than usual. This is completely normal and does not mean you have failed. Simply resume your practice the next day without guilt or self-criticism. Long-term consistency is more important than daily perfection. Now I want to talk about something that can dramatically multiply the benefits of these breathing techniques. It's about combining them with visualization and positive affirmations specific to cardiovascular health. While practicing any of the techniques I taught you, you can add a layer of mental intention that enhances physical effects. For example, while breathing in, you can visualize that you are bringing pure healing, oxygen, and vital energy to every cell in your body, especially your heart and arteries. Imagine this oxygen as a brilliant golden light that fills your lungs and distributes it throughout your circulatory system, cleaning and healing it at your fingertips. As you exhale, visualize that you are releasing all tension and stressing toxins and accumulated pressure. Imagine the tension rising from your body like a dark gray vapor dissipating in the air. You can also use silent affirmations synchronized with your breathing. By inhaling, you can decide mentally, I am filling myself with calm and health. When exhaling, my blood pressure normalizes naturally. Or any other affirmation that resonates with you. The key is that the affirmation is positive, present, and personal. Don't say I want to have normal blood pressure, but my blood pressure is normal and healthy. Your subconscious mind responds better to affirmations in the present time as if it were a reality. It can sound a little esoteric, but there is solid scientific evidence that guided visualizations and positive affirmations can influence bodily functions that we normally consider involuntary, including arterial pressure, heart rhythm, and immunological response. This is due to the deep connections between your conscious mind, your nervous system, and your bodily functions. When you combine conscious breathing with visualization and affirmations, you are taking advantage of multiple ways of influencing your physiology at the same time, creating a powerful synergistic effect. It is also important that you understand the role of magnesium and potassium in regulating blood pressure and how breathing interacts with these essential minerals. Magnesium is crucial for the relaxation of the smooth muscles of your blood vessels, and many people with hypertension have magnesium deficiency without knowing it. Potassium helps balance the effects of sodium and promotes the excretion of excess salt through the rivers. When you practice deep breathing techniques, you are improving the use of these minerals at the cellular level. Breathing improves the oxygenation of your tissues, which in turn optimizes enzymatic reactions that depend on magnesium and potassium. Therefore, it is an excellent idea to combine your breathing practice with a diet rich in these minerals. Foods such as spinach, almonds, aguacates, plantains, potatoes, and frijoles are excellent sources of magnesium and potassium. When you combine adequate nutrition with correct breathing techniques, you are creating optimal conditions for your blood pressure to normalize in a natural and sustainable way. It's like giving your body both the correct tools and the correct instructions to carry out the work of healing. I would also like to share with you some advanced variations of these techniques that you can explore once you master the basic versions. A particularly powerful technique is called box breathing or square breathing. In this technique, you inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, and keep your lungs empty for 4 seconds before inhaling again. This pattern creates a perfect symmetry that has a deeply balancing effect on your nervous system. This is Navy SEALs' favorite technique for maintaining calm under extreme pressure and works exceptionally well for acute stressful situations that can trigger high blood pressure. Another advanced technique is alternating nasal breathing that comes from the yoga tradition but has been validated by modern scientific studies for its ability to reduce arterial pressure. In this technique, you open your nasal cavity right with your right hand, inhaling through the right nose and exhaling through the left nose. Luego inhalas por la derecha, cierras esa fosa, y exhalas por la izquierda. Continue alternating in this way for 5 to 10 minutes. This technique balances the activity of the hemispheres of your brain and has a particularly powerful effect on the regulation of the autonomous nervous system. However, I recommend that you first master the 3 basic techniques that I teach you at the beginning before experimenting with these more advanced versions. First, build a solid foundation of constant practice, and then you can expand your repertoire. I also want to address the connection between body posture, breathing, and blood pressure, which is something that many people overlook completely. Your posture has a direct impact on your ability to breathe correctly and therefore on your blood pressure. When you spend hours hunched over in front of a computer or looking at your phone, with your head tilted downward and your rounded shoulders, you are compressing your chest cavity and severely restricting the movement of your diaphragm. This forces you to breathe shallowly with your chest, which, as you know, activates your stress response and raises your blood pressure. Furthermore, bad chronic posture can compress the blood vessels that pass through your body and your shoulders, affecting blood flow to your brain and contributing to hypertension. The solution is to consciously work on improving your posture, especially when you are sitting for long periods. Imagine that there is an invisible hilum connected to the crown of your head that is gently lifting you up to the top, widening your spinal column. Take your shoulders back and lower them, letting go of your ears. Make sure your computer screen is at the height of your eyes so you don't have to tilt your head down. Get up and move every 3 to 40 minutes. These postural adjustments on the ground will improve your breathing and your blood pressure, which will also reduce the pain in the skin and back that so many people experience from spending hours in ergonomically incorrect positions. Your body is an integrated system where everything is connected, and you cannot truly optimize your breathing and your blood pressure without also attending to your posture and your movement in general. Now allows me to talk about a topic that is absolutely crucial, but the relationship between mouth breathing and hypertension is rarely discussed. Many people, especially during the winter, breathe through their mouth rather than through their nose. Chronic mouth breathing has devastating consequences for your cardiovascular health. When you breathe through your mouth, you are avoiding the production of nitric oxide in your nasal sinuses. Nitric oxide, as previously mentioned, is a powerful natural vasodilator that helps maintain low blood pressure. When you breathe through your nose, nitric oxide produced in your nasal sinuses is transported to your lungs and then to your entire circulatory system, where it relaxes and dilates your blood vessels. When you breathe through your mouth, you completely lose this benefit. Furthermore, mouth breathing tends to be more superficial and rapid, which again activates your sympathetic nervous system and raises your blood pressure. Mouth breathing can also cause sweat apnea or worsen a condition that is strongly associated with treatment-resistant hypertension. If you suspect that you breathe through your mouth during the night, especially if you snore or wake up with a dry mouth, consider using a special medical belt designed to keep your mouth closed during the night. It may be extraneous at first, but it is a simple intervention that can have profound effects on your blood pressure and your sweat quality. During the day, Consciously practice breathing solo through your nose, even during light exercise. This will help you retrain your body so that nasal breathing adapts to your predetermined pattern. The only exception is during specific breathing techniques where it is recommended to exhale through the mouth, as in the 4-6-8 technique. But in general, for everyday breathing, your mouth should remain closed and all breathing should occur through your nose. I want to close this video with a very important message. Hypertension is a serious condition that requires attention and appropriate management, but does not have to be a sentence of lifetime medication and limitations. Your body has an incredible capacity for health and self-regulation when using the correct tools and the right environment. The breathing techniques that I have shared with you today are powerful tools backed by decades of scientific research that you can start using immediately without any cost and without secondary effects. It can literally transform your blood pressure, cardiovascular health, and quality of life in ways you might not have thought possible. But for them to work, you need the fundamental things. First, you need to believe that it is possible, that your body can respond, and that you have the power to influence your own health. According to what you need, commitment and constancy. These techniques are not a magic pill that you take once and pack all together. It's a daily practice that becomes part of your lifestyle in the same way that you can wash your eyes or shower. When you adopt them in this way, when you integrate them into your daily routine in a non-negotiable way, the results you can achieve are truly extraordinary. If you have reached this point in the video, it means that your health really matters and that you are willing to take action to improve it. This puts you very much at the expense of the majority of people. Now is the time to take the next step. I want you to do 3 things right now. First, like this video if you found value in it. This helps people who need this information to find it. Secondly, subscribe to the channel and activate notifications so you don't miss the next videos where you continue to share valuable information about cardiovascular health and natural remedies for hypertension. Third and most important today, start practicing the techniques I taught you. Don't wait until the next month or 2. Empathy now. Dedicate the next 10 minutes to practicing diaphragmatic breathing, and until you travel to healthier blood pressure, your heart and arteries will thank you. Remember, your health is in your hands literally with every breath you take. Choose to breathe correctly, choose to take care of your body, and choose to live a longer, healthier, and fuller life. See you in the next video where we will continue exploring natural solutions for your cardiovascular health. Then, take a deep breath. Breathe consciously, and take care of that heart that works so hard for you every second of every day.